Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Megan Isham. She's Senior Manager of Clinical Systems at Mental Health Cooperative. Welcome, Megan.
Thank you so much for having me.
Yeah, excited to be diving into this. ECW has invested a lot in the behavioral health side of things, so I'm excited to learn about how that's going for you. But before we go there, tell us a little bit about yourself and the Mental Health Cooperative.
Yeah, so I have been in healthcare IT for over 12 years. Wow. I have managed clinical systems and providers for those 12 years. Mental Health Cooperative was founded in 1993. We offer so many services beyond primary care. We offer therapy for child and youth and adult. Wow. We also have a 24-hour unit. It's our crisis stabilization unit for Davidson County. And we also have our PIC and REACH programs, which we're out in the community with police and fire.
That's awesome.
Yeah.
What a breadth of programs. A lot of people don't realize I started in mental health as well, a student health and counseling center. Nice. So I had to balance both. So I understand a bit of the challenges and the unique nuances of behavioral health. Mm-hmm. So tell me, what's been your experience with eClinicalWorks from a behavioral health provider perspective?
Yeah, so they've been like a breath of fresh air for us. So everything with eClinicalWorks is very customizable, which is exactly what we need in behavioral health, because not one consumer is the same. So they have really listened to us and really taken us kind of under their wing so that they can also learn about behavioral health as well, which has been really great.
Yeah, that's awesome. It's funny because I think every specialty feels like they need something customized and special. So it's interesting you say ECW is able to do that for behavioral health.
Yes, it's been wonderful. And my providers love it. They love how they can just ask me like, hey, actually, this sentence right here doesn't fit well. Can we reword it, or can we do something different? And I'm like, absolutely.
Yeah, that's awesome. So ECW has a new outpatient behavioral health module, which I think is really interesting. What drove your need for this solution?
Yeah, so we actually took a lean approach at MHC, which is kind of like a Six Sigma. Most people are familiar with that. For sure. To see what the administrative burden was for our care managers. And so we actually did a time study, and it was taking about 112 minutes to complete a care plan. Wow. Yes, in the old way that we were doing it. Now, I'm not going to lie, we had a lot of Band-Aids in place to make the system work for us. But now we wanted to work for the system. And so we got that 112 minutes down to just 9 minutes.
No way.
It's crazy. It is crazy. My providers are loving it. It thinks like a provider would, and it thinks like a behavioral health person would think. So the notes flow flawlessly.
Wow, that's amazing. I mean, 112 minutes to 9. Like, what do they do with all their free time?
Right. They see more consumers.
Yeah, that's awesome. So talk to me about what are some of the key features you use in the outpatient behavioral health module? Yeah,
so we use the treatment planning. It does have Wiley content, which is really cool. However, just with our state, it doesn't work well for us, which is completely fine. We own it and we say it doesn't work, but you can really track those goals, those interventions, and those objectives really, really well with the new module. And it flows really good in the progress note. So you might not necessarily need to see that treatment plan because it lives in a new behavioral health panel. So
interesting. So tell me more about the treatment plans and what made the difference. Is it that they had good workflows? Is it because they had good content? Like, how did it become that much more efficient?
Yeah, so we, when I say we, I mean me. I really studied what our care managers were doing, and I wanted to take out the waste. So what are things that are not might be beneficial to us, but it's not beneficial to the consumer. And so something that we were seeing is that a lot of the stuff was being done behind the scenes, and the consumer wasn't really involved. And that was wasteful to them because they're sitting there and they're waiting and they're like, what's going on? I don't know. And we're doing all of this work kind of behind the scenes. So we really wanted to take a more collaborative approach, so that we were able to collaborative work with our consumers. And that's where this comes in. And it's just so easy to document. It's so easy to customize. And it makes the collaborative documentation so much better.
That's interesting. So you involve the patient, the client in the process. That's awesome.
Yes.
We know about the shortage in behavioral health. We don't have enough providers to care for the challenges and needs of the community. What are some ways that you see technology kind of helping with this shortage of providers? Yeah,
so it's funny you say that. 98% of our consumers are from Medicaid. So we see a lot of the most persistent mental illnesses. They're the most severe, and there's shortages everywhere. So what we've really tried to do is to use technology in our favor. We don't want it to be part of that waste, right? Yeah. So we're looking into AI tools, not only for our providers, but for our care managers as well, so that they have all the tools that they need to collaboratively see the patient.
Yeah, that's awesome. And what are some of the next projects you're working on with your organization?
Yeah, so I'm looking to expand Helo TV for a more hybrid approach. So that's also how we're going to help with those shortages as well. We have a really unique system at Mental Health Cooperative where we have those care managers that come into your home and they get those care plans and those treatment plans tailored literally for you and your needs.
Wow.
So I'm working on that, the Helo TV, and then we're really wanting to do this year a lot of more patient engagement. And so I'm excited to work with ECW on a more behavioral health focused patient engagement. Instead of just sending out those happy birthday text messages or welcome to our practice or don't forget your flu shot, those are not really behavioral health focused. So I'm really, really excited to work with eClinicalWorks on that.
That's awesome. Well, Megan, I appreciate you taking time to talk with us about the behavioral health side of ECW, something that certainly doesn't get enough attention. I think the mental health in general, not just with this organization. So I appreciate you sharing about your experience and all the learnings from it. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Megan.
Thank you.